Hello everyone, welcome to my channel Kangkana's Health Forum, and today I am here with you to talk about diabetic care. So if you are diabetic and if any one of your family member is diabetic, then this video is for you all. So let's start the video. In this video, I am going to share with you a very important point about diabetic care. So kindly watch the whole video, and now let me start from the number 1 point. Before talking about diabetes mellitus, we should know the concept of diabetes mellitus. So what is that? Diabetes mellitus is a chronic multisystem disease which occurs due to the abnormal insulin production, or if there is an impaired utilization of the insulin, which leads to the abnormal metabolism of the carbohydrate, as well as it also increases the glucose level in the blood. In that condition, we call a patient is diabetic. Let's come to the first point, that is monitor blood glucose level. Because if there is any abnormality in the blood sugar level, so that we will be able to know whether it is high or whether it is low. So the high blood glucose level we call as hyperglycemia, and the low blood glucose level we call as hypoglycemia. So how we are going to identify that? To identify the blood glucose level, you should be thorough about the normal range of the blood sugar level. So if you are checking a normal random blood sugar, then your normal range will be from 70 to 140 mg per dl. And if you are checking fasting blood sugar, then your range will start from the 70 to 110 mg per dl. And if you are checking PPBS, that means postprandial blood sugar level, so that should be from the less than 140. Okay, your normal range should be less than 140 mg per dl. And remember, postprandial means if you are checking blood sugar level after 2 hours of having your meal, so that is called postprandial blood sugar. That's why it is very important to check your blood sugar level regularly, so that if there is any high or low in your blood sugar, you will be able to know, and you can immediately inform to your doctor or physician. And if you are administering your insulin by yourself, or if any one of your family member is giving to you, or if you are the guardian of your patient, then you should know how to inject the insulin. So if you want to know how to inject insulin, let me know in the comment section, so that I can make another video on insulin administration. Let's come to the number 2 point, that is exercise. So exercise is a very integral part of controlling the diabetes mellitus. Don't exercise if your blood sugar level is highly elevated. This may lead to temporary worsening of your blood sugar level, and always try to begin a medically supervised exercise program. Let's come to the number 3 point, that is nutritional therapy, which is very important. And we also know, we have some idea that we should control the diet for the diabetic patient, but there are some fact that most of us we don't know, or maybe some of you know also. So let me start from that. First thing that you have to remember is that you have to avoid alcohol. Why you have to avoid alcohol? Because it may lead to the low blood glucose reaction. Have an individualized meal plan created by your dietitian. Secondly, you remember that you have to always eat at regular time, and whenever you eat something, you should eat very slowly, and you have to chew the food thoroughly. And don't forget to follow your diabetic diet at regular time. Now let's come to the number 4 point, which is very important, and that is diabetic foot care. Here, if you're diabetic, then if there is a small wound in your feet also, it will not heal easily, and if you left untreated, then it may lead to the serious infection. That's why it is very important for the diabetic patient to practice foot care daily. Number 1 point that you have to keep in mind is you have to wear a comfortable, well-fitting shoes to prevent your foot from injury. Don't apply hot or cold directly to your feet. Don't go barefoot, and whenever you cut your nails, you should be very careful. Don't put oil or lotion between your toes, because extra moisture can lead to infection. And the last point is examine your feet regularly at your home. Now I am coming to the last portion of my video, where I am going to share with you some points that you have to keep in mind. So the first one is always carry an identification card where it says that you have diabetes. Secondly, don't ignore the symptoms of hyperglycemia and hypoglycemia. Hyperglycemia means increasing blood glucose level, and hypoglycemia means decreasing the blood glucose level. So you have to remember that. And lastly, don't forget to do an annual eye examination by an ophthalmologist because it may prevent you from a severe vision loss. So these are some points that I wanted to share with you. I hope all of you got some idea how to care for a diabetic patient. This video I made on demand of my subscriber, and if you also want to know about some health related topics, let me know in the comment section below. And if you really like my video, then kindly like, share and subscribe, and thank you.